Okay, thanks, Sarah. Well, welcome everyone to this 10th Aging and Social Change Interdisciplinary Conference, and my congratulations and admiration go to all the organisers. I think it's been extremely good. I saw Andreas's welcome speech and Professor Bar-Ilan's plenary talk, and they've really set the scene for this really good session this afternoon. My name is Angela Kydd. I'm a clinical professor in nursing at Robert Gordon University in Aberdeen, and I'm the UK lead for the Marie Sklodowska-Curie Action Innovation Training Network program, EuroAgeism, of which we have 15 early stage researchers. And we're very fortunate that we have 4 of these early stage researchers presenting their work this afternoon. I personally think it'd be nice if people turned on their cameras, because it's always nice to see faces, and I think it's quite encouraging for the speakers. And I would suggest that you use the chat column if you want to. And as Sarah said, you know, we won't have any questions after each speech. You know, we'll save it for the discussion at the end. So in this hour, each paper has a maximum of 15 minutes, and that gives us about 10 minutes at the end for discussion. I've got to give full credit to Wenqian for organising this particular session and keeping us all right and with all the links that we're ever going to need. And this session, Frailty, Social Care and Engagement Among Older Adults in Time of COVID-19, is the theme for the session. And the first paper sets a kind of attitudinal theme that mixes well with the other 2 papers on the effects of self-ageism and frailty, or possible effects. And so we're starting with kind of the self-ageism, and then we go on to the second paper that looks at how residential facilities have been portrayed in the American press. And the third paper looks at the Chinese social media, as opposed to newspapers, portrayal of older people. So I think without further ado, you didn't come to hear me, you came to hear the speakers. I'll put you straight on to Abodunrin Aminu, who will open up our series of talks. Thank you, Abodunrin.
Hello, I hope you can all see my presentation now.
Yes, we can see it. That's great.
Hello, everyone. Good day. My name is Abodunrin Aminu. I'm an early stage researcher with the university, Robert Gordon University in the UK, and myself and my colleague Lola Kachan said, we're with Professor Angela Kydd. We are part of the EuroAgeism consortium, which included 15 global researchers, just like Professor Angela Kydd introduced. My work is going to be looking at the analysis of the relationship between ageism, self-ageism, and frailty among other individuals. And this is a quantitative systematic review. I would be using the following outline in my presentation. I'll be discussing a very brief background of the topic, and I'll be giving few definitions of the key terms, and I will be talking about the rationale why this is important, and the objectives of the review itself, the methods, our key findings, and the discussion that we could get from the findings from the review, and the key point summary of the presentation itself. So a quick background, vulnerability has been the central theme to define responses during the COVID-19 pandemic. And individuals aged 60 to 70 in different climes were considered very vulnerable, I mean, at the very early stage of the pandemic. So we have different policies at the early stage of the pandemic, reinforcing some sort of belief that could be termed as being ageist in terms of how older people were viewed in the pandemic, and how they were affected by the pandemic itself. So my presentation will discuss this relationship in terms of the relationship between self-ageism and frailty among older individuals, to see if really truly there was any sort of lessons we could learn from what is already in the literature concerning older people's perspective of aging process and vulnerability, as it is widely used at this particular point in time to define responses to the pandemic. To go straight into the definitions, what is frailty? Frailty is a very difficult concept to define at the moment. There are different definitions in the literature to define frailty. But one thing is that frailty is assumed to be part of the aging process. So this really makes it difficult sometimes in terms of what the responses are to people who are frail. And unfortunately, so older people are usually termed frail or vulnerable, which could be ageist in terms of the responses they will get or the treatment or type of healthcare and social care facility they would be able to access. And I think this will be blending with the other presentation by my colleagues, hopefully down the line, and we could discuss this further. But to define frailty in the concept, in the context of this presentation, would take frailty as a state of vulnerability that is due to inability of the body defense mechanism to cope with stressor events. And ageism is another thing that will be coming up in this presentation, which connotes discrimination, prejudice, and stereotypes against a person or a group of people solely because of their age. This was the definition given by Robert Butler in 1969. Ageism could be macro, and at the systematic or institutional level, or it could be micro, which is self-perceived ageism or individual level ageism. Sorry. Why is this important? One of the reasons why this is important is the changing aging demographic. I will take the European continent as a key example. This was the statistics of individuals aged 65 plus and 85 plus in the EU countries for 2015 and the projected figure for 2035. 20 years later, we're already in 2020, so we could imagine what the figures would be. But more strikingly is that if we look at the aging demographic, we could see that individuals aged 65 are likely to if we look at the figure here, we could see for most of the countries, Italy, Germany, Portugal, there will be an increase of about 50% increase in the population of individuals aged 65 and over within the next 20 years from the baseline data, which was 2015. Comparing this with the data for individuals age 65 plus, would see that there would be an increase of almost 100% in the number of individuals age 65 plus. And why is this important? It is important for several reasons. One, it really talks about the focus of health and social care on individuals who are older, because if we approach aging as an umbrella event, then we are likely to be missing out important factors in providing care for those who would need it. And the care for individuals, depending on their age, in this bracket would be different. And this is one of the reasons why it is important to take note of these differences in the projection of individuals within this particular bracket. Then secondly is that for those who are 85 plus, it is more likely that we're going to be seeing individuals in this particular age group getting more than what it is at the moment. So it is possible that we would need to have adequate care for them, if I may say. This is one of the reasons why it is important to really look at frailty at this particular point in time. Then secondly it is important to look at frailty because frailty has been known to increase adverse health outcomes among individuals. Some of these adverse health outcomes includes mortality, fall, and hospitalization. Ageism as a concept has been shown to be detrimental to health outcomes among older individuals, making them vulnerable. So this study actually wanted to look at the relationship between ageism and frailty in this context of individuals who are who are aging and are being subjected to discrimination or are developing some ageist attitude, how does it affect their overall health outcomes? So in our review, our objective was to identify studies that investigated ageism in frail older people, focusing on quantitative approach, and to identify measures that are commonly used to assess ageism and health in older adults and in the included studies. The methods we use, these have already been published in Prospero, and I would really refer you to that to manage the time. But we looked at different journals to look at studies that have been published that included frailty and ageism, and a total of 5,000 records were looked at. We screened these records and we looked at the abstract screening, and we did inter-rater review to identify studies that are very, very relevant to the particular objective of the review. And 10 studies were reviewed at the end of the screening process. And these were the principal findings that we had at the end of the review. There were 4 studies that looked at the relationship between frailty and ageism in terms of the odd ratio of those who have reported age discrimination or attitudes towards aging and their overall outcome in terms of frailty. And there was one that reported it in terms of risk ratio. But the overall finding from this is that it was very difficult to compare this study because of the difference in the measures that were used in the paper. So we were only able to describe what we found in the papers. Then secondly was that we found that the measures of ageism that was used in these papers were mainly attitudes towards aging, because 80% of the paper actually used attitudes towards aging to, define ageism in this particular context. Then frailty was defined in and assessed in the papers using the phenotype frailty tool and the frailty index, which are the 2 widely cited frailty tool and definition used in assessing frailty at the moment. Our review findings shows that negative attitude towards aging was associated with frailty condition among individuals aged 65 and over. And it was also significantly related to poor health condition among these individuals. There was no information on the association between perceived age discrimination and frailty in the reviewed paper. And for myself, I will be taking this forward in my PhD to look at the relationship between age discrimination and frailty, hopefully. Now, what are the things that are striking in this? Frailty is an important indicator for predicting adverse health outcomes and has been particularly useful in clinical decision during the ongoing pandemic. There is a paper that was published in the Lancet in June this year that identified that individuals who were frail were likely to have poor outcomes in the COVID pandemic because the mortality among these individuals were huge compared to those who were not frail. However, this was not related to age. So it is very difficult to use age as a measure for those who are going to be affected by the pandemic or not. Systematic and individual level ageist perception and policy can increase the risks of frailty among older individuals, making them vulnerable during the disaster situation in terms of the access to health and social care. I will take a very good instance. In the very early stage of the pandemic in the UK, for instance, individuals who were 70 were asked to isolate for 12 weeks. The meaning of this is individuals who were not, for instance, frail or maybe could have been otherwise classed as non-frail or maybe pre-frail would have also been asked to isolate. And we know that social isolation in a way affects social participation and physical activities, and this could affect the overall health outcome. So in the future, it is very, very possible that people who have been subjected to isolation at the initial phase of the pandemic could develop some health issues later on. So it is very important that whatever policy that will be in place to addressing situations as these should be well focused and be well grounded in terms of the real factors that could make a person vulnerable, rather than using age as a factor, because this could lead to greater issue in future, considering the changing demographic. And lastly, a previous meta-analysis found that educational and social support interventions are shown to significantly reduce ageism. So we're hoping that there will be future research that can investigate the influence of ageism or ageism-related interventions on frailty among individuals. The key point summary from my presentation is that frailty rather than age has been shown to be an indicator of poor health outcomes during the COVID-19 pandemic. And I would refer you to the paper published by Eltwith et al., which I just mentioned, that was published in The Lancet. Secondly, is that our review findings are suggested that ageist perception can further increase the risks of frailty among individuals aged 65 and over. And considering the population aging in Europe, which is really the population focused on in this review, there is a need to address the potentially huge negative effect of ageism and frailty on the health and well-being of older individuals. Thank you for listening.
Thank you very much, Abodunrin, and thank you very much for keeping to time. And this paper leads very nicely on to Laura Allen's paper. And if we get Laura on screen, I think you can stop sharing now, Abodunrin. And we'll get Laura. Laura's paper is now here, so I'll let Laura introduce her paper and herself. You got to unmute, Laura.
Okay, there we go.
That's it.
But I would also, oh, there we go. Okay. So thank you, Angela, and thank you everyone for attending today's session. So yes, this does lead very nicely into the situation in the US with COVID-19, and particularly in residential care. And so my project is on the portrayal of residential care in American newspapers during COVID-19. And when I say residential care, that means residential long-term care. So any long-term care facility that houses residents. So this does not include home health care, but it's specific to the congregate nature of people receiving care living together. And I will say, so this is an analysis of newspaper articles, and all of the photos that you see in today's presentation are from those newspaper articles. And I didn't do an analysis of the photos, it was just the text, but I included them just so you can get a feel for what, just sort of the image that is being portrayed, not only in the text, but also with the pictures of the situation of COVID-19 during the first few months in the US. And this is, these findings are from a paper that has been accepted into the Gerontologist and will be published soon, written by me and my supervisor, Professor J20. And so I'm a student at Bar-Ilan University and also part of the EuroAgeism program. And so this research was funded by the Horizon 2020 framework program, the Mies Skłodowska-Curie Actions Innovative Training Network. So just some quick background. I'm not going to go into too much detail, but as of September 17th in the US, I think this is the most updated numbers that we have, 8% of the total COVID-19 cases were in long-term care facilities, 46 reporting states, and then 41% of the total deaths due to COVID in the US were in long-term care facilities. And I think that this is true of many countries, that a large chunk, especially of deaths due to COVID-19, have been in these long-term care facilities, typically older adults. But like Abodunrin said, these are older adults who, the ones who are living in residential care are typically frail in some way or have some sort of pre-existing condition. And so that is why there's such a large number of them. And so because of this, there has been a dramatic increase in high visibility news coverage of residential long-term care since COVID-19 has happened. And this was a study that was done by Edward Miller and colleagues, and they looked at several larger newspapers in the US and did a quantitative analysis and saw like a huge jump of news stories covering nursing homes. So they're really hot in the news, right? You've probably seen headlines like this in your respective countries: a wrenching wait at nursing home where coronavirus took hold, nursing homes becoming islands of isolation amid shocking mortality rate. These are both from the New York Times. And so because I was seeing, my supervisor and I were seeing, and probably you as well, a lot of these very like shocking, scary headlines and news stories. And so because of that, the aim of this project was to understand how residential care has been portrayed in the newspaper media through the initial months of the coronavirus outbreak in the US. So I looked at articles from January 21st to May 8th. January 21st was the date of the first known case in the US, and then just through the initial months to have an end point for the analysis. And I chose articles from 3 leading American newspapers, did a search using the LexisNexis database, and I chose the New York Times, USA Today, and the New York Post. And these 3 newspapers are among the top 5 most circulated newspapers in the United States. But the reason I chose these 3 is because they cover a broad spectrum politically. So the New York Times is more left-leaning, USA Today is considered central, and then the New York Post is considered more conservative or more right-leaning. And I wanted to have a range of perspective because most newspapers in the US that are among the top circulated newspapers are left-leaning, but I wanted to make sure to cover a broad range of views. And so for the initial search, 390 articles came out. After I screened them for duplicates and for relevancy, there were 54 total articles that I included in the analysis. And in the paper, you can read more about the details of that process. So for the methods, I completed a critical discourse analysis, which discourse in general forms social structures, but is also formed by social structures. And so the approach, or a regular discourse analysis, is interpretive and explanatory of how discourse creates social structures that we live in, but then also how the society and the social structures that we live in inform and create discourse as well. So it's sort of a two-way street. But the special focus of a critical discourse analysis is that it focuses on power and social discourses that produce and sustain social inequality. And so the way that we talk about certain social structures or certain phenomena in society can hold power and can give power to some institutions and take away power from others. And so a critical discourse analysis looks at how is inequality, how is there an unequal balance of power in specific social discourses. But along with that, because a critical discourse analysis is more of an approach, I used a thematic analysis framework steps in order to make it a more systematic process, so that I put together in themes the critical discourse that I found in the newspapers, which will make more sense as I get into the findings. So there were 3 themes that came out that I found in the newspaper articles. The first is that residents' voices were excluded and their experiences were replaced by those of their family members. The second, residential care is a shockingly dangerous setting. Whoops. And then residential care is deceptive and problematic. So the first theme, resident voices are excluded. So a total of 54 articles, only in 4 instances was a resident actually quoted as being interviewed by a journalist. Or not even always, that wasn't always the case. Sometimes it was a quote from a family member. That was, they were saying what the resident was saying. So the majority of interviews were from the family members themselves. And so we see that because residents were excluded, then family members, their experiences were able to take place of the resident's experience. And it's really, it's something that you don't notice unless you're actually counting and looking for resident quotes. But because it really seems like from the family member's experience, you get a picture of what's going on in the nursing homes. So there's this quote, "As disturbing as the prospect is for elders, it is often scarier for their children." Or this was a headline in USA Today from an opinion piece, "I can't visit my mom in her nursing home. Guilt, second guessing haunt my days and nights." So there's a huge focus on the family members' experience of their loved ones living in a nursing home or in a residential care facility. And because of that, and also it's mostly family members, but also staff, their experiences also are at the forefront. But because of that, then the residents of nursing homes are portrayed as entirely helpless, and they're portrayed in a very stereotypical way. So like one administrator used the term diaper, which is when referring to adult underwear, which is a very derogatory term. They're referred to as sitting ducks because of the virus going through a nursing home. And then the term elderly is used over and over again, which academics have determined that the term elderly is an ageist term because of it connotates frailty. And so they're seen as like they're portrayed as just one type of group of people, whereas you don't get any individual experiences during the coronavirus going through a nursing home. The second theme is that the coronavirus is portrayed as very dangerous, and they use very shocking language and shocking literary devices and linguistic strategies in these articles. So coronavirus in a nursing home can be like fire through dry grass. This was a quote from one governor that was quoted in 5 separate articles. They're referred to as deadly petri dishes. And the coronavirus was said to stagger, startle, knock staff completely off guard. And this is really culminated in the Kirkland symbol. And so Kirkland, the Life Care Center of Kirkland, was the site of the first coronavirus outbreak in the US. And it was a nursing home that first experienced the virus, and the staff were very underprepared. There was a lot of panic, and they had a shortage of supplies. And so the Life Care Center of Kirkland is referenced several times in articles about other nursing homes, where they say they'll be explaining what's going on at this nursing home in Virginia, and then they'll refer back to Kirkland. And so it's really used as a symbol of panic, of danger, of disaster, right? And so people make those associations in their mind when they see, oh, Kirkland, or even just this photo that's not even in a story, not even about Kirkland. And so this is one way that we see how the danger and the shock is culminated into one symbol. And then thirdly, the long-term care industry in general and nursing homes are portrayed as very deceptive, and it's a problematic industry. There's a lot of ambiguity of terms that are used and skepticism. Like, I still question what's going on in that nursing home. And this is seen a lot over and over of like, we don't really know what's going on. Public health officials are not telling us the true numbers of cases in long-term care homes, or, I can't have contact with the residents, and I think that like something's really going on. So there's a lot of skepticism and paranoia. And then also many articles, even if it's in an indirect way, but they will assign blame to one party or to one or two particular stakeholder. And this typically followed the political leaning of the newspaper. So, for example, the New York Post, which is more conservative or more right-leaning, they would detail the story of the virus outbreak in a nursing home, and then somehow would always bring it back to the Democratic governor of New York, Governor Cuomo, as it being his fault. They would always come back and maybe even the New York Post is pretty explicitly blames him. But it would always follow sort of the political leaning of the newspaper. Or like the New York Times, for example, which is more left-leaning, tended to blame the corporations and the CEOs, administrators who were out to get money. And so I didn't do a quantitative analysis of that, but that's just a finding that I saw within the data. So I think I have a little bit more time here to just briefly go over the discussion and conclusion. So the reason this is really important is because the journalistic discourse in newspaper articles contributes to the common knowledge that we have of reality in residential care. And this repetition of alarming language and shocking stories creates panic. And they use, I didn't go into detail, but there's a lot of linguistic strategies that are used. And there's fear-mongering that's going on. And so if we look at the implications that this has for the industry, I can predict that this is going to cause a huge mistrust of the industry. Or if someone didn't trust long-term care homes before, they really won't trust them now. And this blame that is assigned to one person in particular or one party in particular, this really prevents a holistic understanding of all of the problems, the systemic problems that are in the long-term care industry in the United States as a whole. And then the main key finding, I would say, is the illusion of inclusion. And this goes back to the first theme where we don't even realize that residents' voices and experiences are not being included in these articles. And so when you read it, you think that you understand what these people are experiencing, but actually we don't hear from the residents themselves. And so this is really important because if we are not including them in discussion in newspaper articles or just in discussion in general, and we don't even realize that we're missing that voice, then that can really have detrimental impact on residents down the road. And it can penetrate into other areas such as their healthcare decision making and things like that. So again, those are all summarized more nicely in the paper. And here you can follow me on Twitter if you want. And I would be happy to discuss more at the end of the presentation. Thanks.
Thank you very much indeed, Laura, and really lovely presentation, another really lovely presentation. And we'll move on to our third presentation that's going to be given by YUSC and Wenqian Zhu. And Wanyu is studying in Israel but lives in China, and Wenqian is studying in Sweden and lives in China as well. So thank you very much. Have you unmuted?
Okay. Yeah. I was muted. Well, thank you, Angela, and good evening from China. So today I'm going to present one of our recent publication. I co-authored with my supervisor, Professor Bar-Ilan, and also currently I'm visiting PhD students in China and Peking University. So this paper is also co-authored with my current supervisor in China, Professor Zhang Xin, and also my colleague Wenqian. So our research is about a thematic analysis of Weibo topics. I will explain what is Weibo topic later regarding older adults during the COVID-19 outbreak. Well, so firstly, thank you for Laura's presentation, as she already explained the importance of research on the portrayal of older adults in the media. Well, currently there are a lot of research about older adults, the portrayal of older adults in the media, but it's all conducted in the Western media during COVID-19. And older adults are usually portrayed as helpless, frail, incompetent to contribute to society. And we can also see a lot of ageist stereotypes and attitudes on Twitter in times of COVID-19. Especially we can see from the most heated hashtag on Twitter, which is called the boomer remover. Well, but our research interest is what about older adults in the Chinese media during COVID-19? Well, we all know China is the first country who were suffered from the COVID-19, and also some research has pointed out that China has different culture from Western. Chinese people hold a relatively more positive attitude towards older people. So we are expecting whether there is some different findings in the Chinese media. So our research specifically focuses on Weibo, a most popular Chinese social media platform, which is similar to Twitter. And so here you can see a screenshot of the Weibo hashtag web page. So our research goal is firstly to identify major themes in all Weibo topics related to older adults during the COVID-19 pandemic. Well, the hashtag on Weibo platform is similar to the hashtag on Twitter, but it also has some differences. Usually the Weibo topic are generated by the organizational accounts instead of for private accounts, and it also these topics are generated from some heated news. So the topic is the literature is relatively longer than the hashtag on Twitter. And so we also want to explore the popularity of each theme based on public views and comments. And finally, we also want to explore the temporal trends of dominant themes to identify changes in the portrayal of older adults over time during the COVID-19. So we firstly searched some keywords on the Weibo topic search engine. For example, we searched older people, older aged people, grandma, grandpa in Chinese, and we then went over the search results and manually selected topics that were related to COVID-19 in China during the period from January 20 to April 28, 2020. And we selected this specific date according to the State Council Information Office of China, because these two dates signifies the beginning and the initial success of our fight against the coronavirus. And finally, we got 241 topics. We merged identical topics, and finally we reached 188 unique topics. So firstly, we did a thematic analysis through an inductive approach. Well, this process was conducted independently by me and Wenqian, and the consensus was reached via consultation with 2 additional team members who are our supervisors. And since, as you can see on the screen, since on the Weibo topic web page, there are 2 data that are available. One is the view frequency of this topic, and the other one is the comment frequency. So this enables us to calculate the theme popularity. So we firstly calculate average view frequency of the theme by adding up the view frequency of all topics under the same theme and dividing it by the topic frequency. We applied the same approach to calculate the average comment frequency. And so finally, in the end, we got 6 main themes. the most prominent theme is about how older people are contributing to the community. This is actually much to our surprise. It's very opposite to our expectations. And in this theme, it's about how older people are actively engaged in fighting against COVID-19 through donation of service, money, and goods. So in the first picture, you can see it's a picture from one of the heated topic. It's an older grandma who donates almost half of her savings to the government, try to help the local to fight against the COVID-19. And the second most prominent theme is about older patients. Well, even though it's about older patients, but all these topics are portraying the older people from a very positive way. For example, they portrayed older patients are full of optimism during the treatment in the hospital, full of love and full of appreciation to their medical supporting team. And for example, you can see this older grandma is hugging her doctor, and she is cured, and just draw a picture on the protection suits of the doctor. So it shows how she is full of appreciation to the younger generation, to the medical team. Well, among the rest of the themes, we can also see intergenerational solidarity. One of the themes is about older people as care recipients. It mainly describes how older people receive the respect and the heartwarming care during the lockdown. For example, they get special care in hospital and special care during the quarantine at home. So these are the two major sub-themes under this care recipients theme. On the other hand, is another major theme about how older people are caring for the younger generation during this pandemic. And one of the topic shows, for example, how the grandfather is taking care of the grandchildren and making a self-made protection clothes for the grandchildren. So this greatly attracts people's attention and discussion on the social platform. So we are also curious about how people's public response to these themes. So the most prominent theme contributing to the community attracted the most public comments per topic. It is worth noting that one topic, 84-year-old Dr. Nan Shanzhong fights on the front line against the pandemic again. Dr. Nan Shanzhong was the leader during the in 2003 when China was suffering from SARS, and now he is already 84 years old, and he stand out again and being not just the leader, but also even a spiritual leader in leading the fight against the coronavirus in China. And so the topics about him greatly attracts people's willing to discuss and willing to read the news about him. Well, but the public responded least to older adults as care recipients, with the lowest average view frequency of about 16 million per topic, and the common frequency about 2,000 per topic. Well, the least theme, older adults as public health rule breakers and followers, accounted for the smallest, even though it accounted for the smallest portion among all themes, but it attracted the highest average number of views per topic. But I think this because of there is an outlier. One topic about diagnosed older adult concealed the information and caused more than 100 close contacts greatly attracts people's view and discussion. So this makes the average view frequency per topic goes up really high under the theme of public health rubric and follower. Well, according to the stereotype content model, usually older adults are perceived as being high in warmth, low in competence, and further leads to the feelings of pity and sympathy towards older people. But our finding gives us a new aspect to understand older people. The most prominent theme in our finding is contributing to the community, which portrays older people are actively exercising their agency to reduce the impact of COVID-19 through their own effort and their ability. And also it shows the warmth among older adults. They are very willing to donate what they have. In addition, the theme of caring for the young and the sub-theme of public health rule followers shows the competence and shows the competency of older adults, and there also shows the older people are actively engaged in the fight against the virus. So our finding supports both the stereotype contents, which is that older people are high in warmth, but on the other hand, it also shows non-stereotyped contents, that older people are not necessarily being incompetent. They are actually showing their ability to contribute to the whole society in this special time. Meanwhile, these depictions greatly attract public attention and endorsement. And so finally, we also did the themes temporal trends. So the most prominent theme of topic is contributing to the community. So in this theme, it accounts the majority of the contents in the first stage, in the outbreak of this stage. But on the other hand, we can see that the public in China are more focusing on intergenerational solidarity than other issues. As you can see, the theme that older patients in hospital increase a little bit in stage 2 of turnover and stage 3 post-peak. And also the older people as caring for the young also significantly increasing to 28% in the last stage. But compared to other themes, for example, older adults as a vulnerable group or public health rubric and follower, all drops to 0 and the final stage. So we can see a very positive and a promising intergenerational solidarity might forming during this COVID-19. So finally, in general, our results, the results of this research are substantially different from findings based on Western media. So we summarize 2 potential reasons. Firstly, as we all know, that China are deeply rooted in Confucianism and the culture of filial piety in Chinese society, which stresses respect for older adults and the importance of a parent-children relationship. So Chinese people tend to have more positive conceptions of older people, especially in terms of competence and admiration. This can be seen from the most heated topic, as I mentioned, that the 84-year-old doctor is being even a spiritual leader during this hard time in China. And so people hold relatively more positive attitudes than Western people. But another possible reason is that, as I mentioned at the beginning, Weibo topic is similar to Twitter hashtag, but it's also different. Most topics on Weibo are initially generated by organizational accounts rather than by private accounts. So for these organizational accounts, in order to maintain a certain public image, they prefer to report more positive and less ageist content than private accounts. And so these might be 2 factors that contribute to the result we found. But this research could also give us opens a window for us to understand the cultural difference between Chinese Eastern culture and the Western culture regarding people's attitude towards older people. Well, so that's the end of the presentation. And if you are interested in more details, you can go to the link and read our paper. That's it. Thank you.
Wanyu, thank you very much. And for someone to give such a good paper with a high fever and in a language that isn't your first language, I absolutely applaud you. I think you did that really well. This has been a really interesting session. I think they talk about, you know, we're in a COVID storm, but we're all in different boats. And I think, you know, we've all been, it's really shone a spotlight on the inequalities in our societies. I think Abodunrin set the scene, you know, talking about the difference between frailty and age, and spoke about the legislation that came in the UK of people aged 70 and over having to stay in their own homes for 12 weeks, when these people were actually, as Wanyu had said in her presentation, some of the main contributors in our voluntary organisations. Laura spoke about the shock horror headlines in the press of the residential homes, and actually that backlash has actually served to put some of our residential homes in the UK in a good light now, because people are saying, why were they forgotten when all eyes were on the hospitals and the intensive care units, and people were being discharged into care homes with COVID. And of course, you know, we had 40% of our deaths, COVID deaths, that took place in care homes. And I think, you know, the final uplifting presentation of how older people have been portrayed in Weibo in a very positive light. And it does make you wonder, are we in danger of going too far the other way? That now we're getting a lot of shock horror headlines about young people having house parties and not being responsible. And I like the fact that the final presentation talked about the intergenerational aspects of looking at societies. So I would say thank you very much to all our presenters. There was an interesting comment from Peter who said, could we ask all our panelists what one thing in your research has surprised you most? So if we start with Abodunrin, what surprises have you, well, what one surprise have you had from your research? You're muted, you need to unmute, Abodunrin.
Okay, I thought I'm already, okay, thank you for the question, Peter. I think one thing that really resonated is the fact that the older population is not an homogeneous population, it's an heterogeneous population consisting of different individuals with different capacity. So we should really look at individuals with their needs and address them differently, rather than grouping everyone into a particular shoe and sort of addressing other people with different age spectrum the same way. So I think this is one thing that resonated in my research, and I would really like to acknowledge.
Thank you. Laura, would you like to unmute yourself and tell us what surprises you had, or what one surprise you had?
Sure. Thank you, Peter, for the question. Yeah, I think something that I should not have been surprised about was just how what fear-mongering tactics were used in the newspapers, and how it was just over and over repeated. And it was like, this was the clear message, you know, and I thought, wow, like, they're not willing to look at any other perspectives of what is going on. And I think that was probably what surprised me the most, is just how, like, yeah, like they would play on emotions, and they would play on just different literary devices that really made you feel like, oh my gosh, this is really bad, you know. So that was probably the most surprising.
It was actually on the news this morning that a woman of 104 has made a YouTube video of appealing to the government to let visitors into the home. So you could look that up. And finally, Wanyu and Wenqian, with your presentation, what surprised you most in your research?
Sorry. Yeah,
maybe
that. Yeah, you can go first.
Okay. Well, for me, as actually I already mentioned in my presentation, we found, to our surprise, we found the most prominent theme is actually rather positive, that older people are actually contributing a lot during this hard time in China. And there are a lot of discussion and on the social platform, and people are actually holding very positive attitudes. So that's why they want to not just read, but also share to the others and discuss. So that's why the popularity of this theme also ranks the highest among other themes. But since in this research, we are not able to analyze the content of people's comments, actually our further research goal is to to analyze the content of the young people's feedback on each one of the topic. We hope we can find more interesting results.
Okay, Wenqian, do you want to say anything before we move on to Margaret, who wants to say something?
Yes, I just want to quickly add one point. I'm surprised by a lot of social media users are discussing the living conditions of older people under those hashtags are analyzed. And although these comments sometimes are offensive, but the majority of comments are more showing support for the agency of older people. And also I'm happy to see like people can engage in those social issues, no matter the COVID-19 related policies or elderly care issues.
Thank you, Wenqian. Margaret, would you like to make your comment? You said you'd like to say something verbally. You have to unmute yourself.
I always forget that unmuting part. Thank you very much. I was really taken by all three presentations, and many things resonated with me, so I was writing notes as I went, and I'll just go over them. Thank you all for such illuminating presentations, and especially the contrast between Laura's and the presentations on Weibo in China. What a difference. It'll be very interesting to see the further research on that topic of critical discourse analysis. What I also really liked was the counter discourse in the Weibo analysis. It's very extreme counter discourse to your presentation, Laura. Very interesting. I wanted to respond to Abodunrin's main point of assessing the vulnerability of older adults based on frailty rather than age. I've experienced that myself. I'm 67 and I look younger, so people don't know how young I am, how old I am. And they often, I'm very offended by these age-related assumptions about me. I'm in very good shape. I'm not in any way frail. And I doubt that I'm going to get much worse when I hit 70. Not going to be suddenly frail. So I would much prefer being judged on my frailty level. But given that, my presentation is about, partly about a woman named Helen who lives in a nursing home in North America. And she survived COVID. She's 91 and very frail, and she survived COVID. So she herself is a counter discourse. Her story is a counter discourse to this idea that frailty, although it statistically may make people more vulnerable, doesn't necessarily. And in her situation, take a look at the presentation. I invite you. It may have something to do with her mental health and her outlook on life and her spirituality. So those are things to look at, perhaps Abodunrin, more than the physical levels of frailty. Is what's mental frailty? Are there any measures of mental frailty? And how does
I'm afraid I'm going to have to try and wrap this up, Margaret. I'm so sorry to interrupt you, but we're out of time now.
Oh, I'm sorry.
So it'd be really good for this discussion to go on maybe in another virtual forum. But I'd also like to just finally say that COVID has thrown a real curved ball to all our research. And none of them have blamed COVID for the change in focus that they've had to make, and they've all given great presentations. thank you all for a really interesting session. And we're just about 2 minutes of time, Sarah. So thank you very much for setting this up.
Thank you all very much. At this time, if everyone would like to go ahead and unmute themselves, and we can give some applause to the presenters. The unmute button is just in the bottom left corner of your screen. So with that, thank you to our presenters. Hope to see you all at the plenary session in just about 15 minutes. Take care.
Thank you very much.
Thank you.
Bye-bye, everybody.